Hello, and thank you for taking the time to join me today. My name is Stephanie Dewar. I am the mental health administrator here at Harbor Hope Behavioral Healthcare. Today, we are going to look over our crisis response plan. This is our organization's blueprint for ensuring the safety and continuity care for our clients, staff, and community in the event of a large-scale emergency. First, we will review our comprehensive crisis response plan. However, we are here today to discuss specifically organizational safety goals related to terrorism events. At Harbor Hope, we strive to ensure the safety and well-being of all clients, staff, and visitors through proactive preparation, effective protocols, and strategic collaboration in the event of terrorist threat or other incidents. Effective crisis response begins with planning. At Harbor Hope, we have developed a detailed and adaptable plan that outlines roles, responsibilities, and response strategies that create a framework for a wide range of emergencies, from natural disasters to terrorist attacks. Our plan is reviewed regularly and includes input from both staff and community partners. We know no one navigates crisis alone. Community partnerships are a cornerstone of our plan. We collaborate with local emergency services, hospitals, school districts, and community organizations to ensure seamless coordination during emergencies. These relationships help us expand our reach and provide wraparound support when it's needed most. Our community partnerships with local law enforcement, fire departments, and local health departments are part of a bigger incident command system in which we are one of many agencies working within a system to provide large-scale response. Other community partnerships include the local medical supply store. We have developed an MOU and they will provide personal protective equipment like hand sanitizer, masks, and latex gloves in the event of a large-scale crisis. Additionally, we have established an MOU with the local HEB to provide water and snack items in the event of a community crisis event. Ideas for other valuable partnerships are welcomed. The crisis response plan prioritizes preparedness through regular training, drills, and scenario planning. Our staff is equipped to manage crisis with confidence, whether it's evacuating safely, transitioning to remote services, or providing trauma-informed care during high-stress situations due to continuous professional development and training. We have a team of clinicians trained in critical incident stress management that routinely meet to run scenarios and keep their skills sharp. Additionally, all staff are trained in psychological first aid and are prepared to provide basic trauma response. Our designated safety team has created easy to remember codes and procedures for different situations, and those are reviewed by all staff quarterly. Drills such as fire drills and active shooter drills are performed quarterly. Additionally, our IT team conducts cyber safety training yearly and maintains systems that are prepared to go remote if necessary, including wireless radios, walkie-talkies, and portable Wi-Fis. The leadership team meets quarterly to review current plans and make improvements based on current events and lessons learned. The safety of our clients and staff is non-negotiable. From physical security measures to emotional wellness protocols, our plan includes detailed procedures for maintaining a safe, stable environment. The building remains locked, and staff have strict protocols for escorting clients throughout the building. Security personnel check in any visitors. We have signage and protocols for hand washing and reporting illness. We also offer an ongoing wellness program and access to employee assistance programs to support staff resilience. Our approach to mitigation includes proactively working to prevent negative impacts due to crisis, as well as reducing inevitable risks before they escalate. We actively cross-train staff for essential roles to ensure that operations and crisis response can continue regardless of who is available. We routinely assess vulnerabilities regularly to stay ahead of potential disruptions. For example, we utilize cloud-based EHR systems with automatic backup to prevent data loss. We employ redundant internet and power sources, including generators and battery backups for continuity of care, and we have a strict cybersecurity protocol, including firewalls, regular software updates, phishing training to protect patient data. Additionally, we have a stockpile of critical medications and supplies for clients who cannot miss doses and backup inventory tracking systems. Redundant communication channels are also in place to ensure communication is available during an emergency. We have printed phone trees for staff, internal messaging apps, and satellite phones. Pre-scripted messaging templates have been created and disseminated to the leadership team for rapid outreach to staff, clients, and the public. We also conduct regular communication drills to test systems. Additionally, we complete regular safety audits of buildings and grounds to identify and correct hazards that may be affected by severe weather or flooding. Mitigation in combination with planning and practice can eliminate many unnecessary issues. Thanks to our extensive planning, we can respond confidently in an immediate and coordinated manner in the event of a large-scale crisis. The response phase includes activation of our communication crisis plan, establishing a command center or coordinating with larger incident command, and ensuring continuity of care through telehealth or mobile outreach services as needed. We also use our various communication channels to communicate clearly with families and community partners throughout the event. Detailed roles and responsibilities of each staff member have been clearly outlined and trained for during the planning and preparation phase. We recognize that recovery is more than restoring services. It's about healing. In the immediate aftermath of an event, we will deploy our critical incident stress management team to provide debriefing support to groups and individuals as needed. Any additional staff will report to incident command and provide support using psychological first aid training wherever needed. Both of these evidence-based practices serve to provide immediate support to survivors and empower survivors to be a part of their recovery. Following the immediate aftermath of the event, we will continue to support clients and staff through post-crisis counseling. The leadership team will conduct a debrief to evaluate our performance and revise our protocols based on lessons learned. In addition to this comprehensive framework for crisis response, today we want to strengthen our response plan with specific goals related to terrorism events. First and foremost, we want to strengthen our facility and operational security. Goal number one is to ensure that all Harbor Hope locations have comprehensive physical security measures in place. Specific action items for this goal include installing access control systems, surveillance, and panic alarms. Additionally, we will conduct quarterly security drills, including active shooter and bomb threat scenarios. We will also partner with local law enforcement for routine facility assessments and safety audits. Goal number two is to develop and maintain a terrorism response protocol. We will implement a clear, staff-accessible terrorism response protocol aligned with federal and state emergency response frameworks. Action items related to this goal include creating an all hazards terrorism response section in the current crisis plan, including evacuation, lockdown, and shelter-in-place procedures. We will also train all staff annually and include new hires during onboarding. Our third goal is to enhance our current real-time multi-channel communication to ensure consistent communication in the case of terrorism-related events. Action items related to this goal include implementing emergency alert software for rapid staff notifications. We have chosen Crisis Go, which will be installed on all staff phones. Training for Crisis Go will take place as part of our routine training and will be added to our onboarding processes. Additionally, we will establish a communication tree and designate roles. This has already been done through our current crisis plan, but will be reevaluated to ensure efficiency. Finally, we will also maintain and update emergency contact list for clients and staff. Goal number four is to maintain and strengthen our current relationships with first responders and emergency agencies to ensure a coordinated response to terroristic threats. Specific action items related to this goal include joining regional emergency planning groups. A designated person from our leadership team will attend any planning meetings and report back. We will also organize and conduct joint training sessions with local police, fire, and EMS. And finally, we will share mental health resources with partners to support trauma recovery. Goal number five is to ensure that both staff and clients are supported emotionally during and after a terrorism-related incident. Action items related to this goal include providing psychological first aid training and refreshers to all staff. Each staff member will download PFA Mobile on their devices for quick and easy access during a crisis event. We will prepare for post-crisis counseling services. We will have pre-made crisis bags that have relevant materials like psychological first aid handouts, community resources organized by type of service, pens, paper, coloring books and crayons for children, and lanyards that identify staff as Harbor Hope employees and psychological first aid responders. Finally, we will develop debriefing protocols to promote recovery and resilience. These debriefing protocols will follow critical incident stress management, which we already have a team trained in. At Harbor Hope Behavioral Health Care, we know that resilience is built before the crisis. By investing in planning, partnerships, and people, we're ready to lead with compassion and clarity, no matter what comes our way. Thank you for being a part of our team with your commitment to safety and service. If you have any questions about the crisis response plan, any policies or procedures, or if you have ideas for improvement, please contact me to continue the conversation.